In this video, we'll cover some medication additions and some guideline updates. For the medication additions, we're adding Keppra and Ancef with a major TXA dosage/administration change. And then finally, we'll review the guidelines in which these medications affect. For Keppra, let's talk about some indications. We'll give it for mild clonic seizures. That's like jerk-like activity. We'll give it for partial or focal seizures, so affecting one portion of the brain, which has many different manifestations. Full tonic-clonic seizure, that's full body jerking. And we'll give it for seizure prophylaxis in hemorrhagic CVA, ischemic CVA, and TBI. So I want to break down here for the seizures. We're only giving it if the person is actively seizing. We're not going to give this for reports of seizures. We're not going to give it for history of seizures, only when they're actively seizing. For seizure prophylaxis, prophylaxis means prevention of hemorrhagic stroke, ischemic stroke, and then of course traumatic brain injury. This is to prevent seizures from either increase in ICP or intracranial pressure or decrease in blood flow, which can cause a seizure. For the contraindications, Keppra has a really good profile. The risk-benefit package is basically all benefit and very little risk. What I want you to take away from this is if they've already gotten Keppra, meaning it's a transfer, taking the patient from HGHER to Renown for whatever, say TBI, you're not going to give a follow-up dose of it. Other than that, Keppra is a really safe, really effective drug. Let's look at the dosing and how it's supplied. For adults, we're going to give 1 gram that's put into a 100 ml bag and is infused over 15 minutes. Again, like we talked about, we will not administer a follow-up dose. For pediatrics, we're going to use 30 milligrams per kilogram mixed to a concentration no less than 10 milligrams per ml, meaning that we can make it more dilute but not more concentrated. So more concentrated being like 15 or 20 milligrams per ml. The least that we can go is 10 milligrams per ml. The max dose, of course, for pediatrics is always the adult dose. So no more than 1 gram in one single dose. Keppra is supplied in many ways. Likely we're going to be carrying it in a powder form. It's more cost effective, it lasts longer, and this really isn't that difficult. Generally speaking, it'll ask you to add 3 or 5 mLs of saline to the vial. You'll lightly shake it till it mixes, and then you'll draw it and add it to the bag. Next, let's talk about Ancef. Indications. Acute, significant skin system damage, usually resulting from trauma. So some examples are large lacerations, deep puncture wounds, or like large skin abrasions from like road rash. We're not going to be giving this for small, little, tiny abrasions. Contraindications. Basically just infants less than 1 month of age. For dosing on the adults, we're going to do 2 grams slow IV push over 2 minutes. For pediatrics, it's 50 milligrams per kilogram, again, slow IV push over 2 minutes to a max dose of 2 grams. Some pearls, we want to use caution in renal failure patients. This actually can make the renal failure worse. So we need to weigh the risk-benefit package here. The way that I think about this is if the patient is significantly injured from trauma, they don't need a secondary infection, which will decrease their survivability. So you're going to have to weigh that. If they're not really damaged, but they have maybe a large laceration, maybe hold off, and depending on how far the receiving facility is. And just to repeat again, this is not recommended in minor trauma or minor breaks in the skin system. TXA update. This is really a dosing update. We used to give 2 separate doses of 1 gram. Now we're giving both grams in 1 dose. So what we'll do is we draw both of the vials into 1 syringe and then do a slow IV push over 10 minutes. As a reminder, TXA is not indicated for children under 16 years old. 3 guidelines have been affected by the drug changes. T1 or general trauma care, M5 or adult seizure activity, and PM3 for pediatric seizures. In addition to these guidelines, the TXA drug card has been updated for dosing, and there has been an addition of an Ancef and a Keppra drug card. For T1 general trauma care, The only changes have been the additions of Ansef and Keppra and the updates on the TXA dosing we talked about. If you are not familiar with this guideline, I encourage you to review it. M5, adult seizure activity. We've made a few other minor adjustments than previously discussed. We have added Keppra, but the minor adjustments are the removal of Ativan, and we have updated the Versed dosing. The Versed dosing is now 2.5 to 5 milligrams IVIO PRN. If you are unfamiliar with this guideline, I encourage you to familiarize yourself with it. PM3, pediatric seizures. Changes are the addition of Keppra and the minor change of removing Ativan. There is no Versed dosage change for the pediatrics. Again, if you're unfamiliar, please review the guideline. There are some requirements that you must complete prior to administering these medications. 1, complete this training video. 2, review the 3 guidelines and the drug cards mentioned in this video. And pass the quiz. The guideline will be live as of 8/17 at midnight. And of course, if you have any questions, feel free to contact me at any time. This concludes the medications update.